Chairman, we're ready to begin.
Thank you, Denisha. Would you please call the roll of the board members?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Russell Crutchfield,
Here.
Cynthia Rucker,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
Shane Mobley,
Here.
Robert Coles. Robert Coles.
Here.
Thank you, Chairman. That concludes my roll call.
Thank you, Denisha. We have a full complement of board members tuning into the meeting today and appreciate very much all of you taking the time. I know you're all busy people to participate in today's meeting. We have a quorum to conduct business, and so I will call the meeting to order. Our agenda today, we have really five items on the agenda that we as a board will be asked to address either for initial adoption or on 4 items, but 1 item for final adoption. And we'll move right into our agenda, which I will ask our secretary, Dr. Cynthia Rucker, if she's had a chance to read the minutes of the October 12th meeting and would in fact recommend approval.
Yes, Chairman Board, I have reviewed the minutes from October and I find them to be in order. And I do recommend they be approved as stands.
Been recommended that the minutes of the last meeting be approved. Is there a second for that?
Dr. Lee seconds.
Dr. Lee has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the minutes of the October 12th meeting are approved. Next on the agenda is a committee report from the Care Management Committee that met earlier this morning. And I'll ask Anthony Williamson, chairman of that committee, if he would give his meeting report, please.
Thank you, Chairman Boyd. We had a very, very good meeting this morning. We started off with Lynette Rhodes giving us a couple of updates. The first was on the Medicaid redetermination process, which is currently in month 6. So we're about halfway done with that. And it was reported that about 400,000 individuals have been renewed to date. There are efforts to move more folks into the auto renew process if that is possible. Others must complete, the enrollment. The other update was on provider revalidation. This is a process that's mandated by the federal government. It started in September. Over 20,000 Georgia providers locations have been validated so far, and the deadline for this is now the end of the calendar year, December 31. Notices have been sent via the, mail to all of the providers about this process. Those providers who have not completed the revalidation will have their enrollment status suspended and will have to get reinstated after the deadline. We then had a very good report from Dr. Holloway and our medical directors from our various CMOs on an overview of health disparities in the state, with a large focus on access to maternal care. And we heard a lot of creative programs, focused programs that the CMOs are creating and implementing to address the issue regarding access to maternal care, things like education, pilot programs, focus on follow-up care, monitoring, getting proper food, etc. We had some good discussion after these presentations with our board members, and then our meeting concluded.
Thank you, Anthony, for your report. Is there any questions for Anthony regarding the Care Management Committee meeting or any comments, please? Hearing none, thank you for that report, and we'll move to the next agenda item, which is the Commissioner's report. I'll turn it over to Commissioner Carlson.
All right, thank you, Mr. Chairman, members of the board, and all of you viewing virtually this morning. Your DCH team continues to be active statewide in the weeks building up to both the holidays and the legislative session. Specifically, I want to thank the SHBP team for wrapping up another successful open enrollment, which constitutes a lot of work, a lot of constituencies out there across the state, a lot of in-person meetings across the state, and a lot of personal touches from a constituent perspective of really helping these employees, retirees, and their families make the best decision possible for their family. So I'd like to thank the team for the work that goes into that. And additionally, I'd like to thank members of our State Office of Rural Health team, along with our finance team, for multiple presentations over the past month, from Senate CON Committee in Savannah to the House Rural Development Committee in Statesboro. A lot of great conversations and a lot of topics that require a lot of preparation. And I look forward to joining our State Office of Rural Health team and back in Cordele next week as we host the Georgia Trauma Commission for their next meeting. And that also happens to coincide with National Rural Health Day. So worth celebrating, and look forward to getting a lot of information out on that and celebrating those providers that mean so much to that part of our state. Additionally, there continues to be a tremendous amount of work towards the RFP process for the state's care management contracts. In fact, our team's meeting later today, go through the next round of questions and formulate department responses that give better clarity and direction to all interested parties. By last count, I believe the number of questions received was over 360. And all of those are thoughtfully considered and responses given to again provide further clarity and certainty for the process, so everyone knows the department's posture going into this. And obviously want to thank our team across multiple sections, divisions, but also our partners at DOAS who help us navigate these waters and execute the state's largest procurement. A deadline of note is those bids will be received by December 1st. And a lot of work goes into that, and obviously the holidays will factor into that. So we want to continue getting that information out there for the December 1st receipt of all that information. As Mr. Williamson mentioned on the committee report, there's a lot of work still going on with redetermination, with provider revalidation, and with the pathways to coverage initiatives. All of those are important items that have a significant policy, systems, and technical lift, if you will. There's constant reassessment of the program, reassessment of the systems. How can we make it better? How can we make the family experience, the consumer experience better? So we thank all our partners and all our team members that are constantly evolving in that process and trying to help it run smoother each month. And as always, Mr. Chairman, today's agenda reflects quite a range of initiatives, services, and constituency groups, all of which deserve to be heard. So today alone, we have items before us pertaining to primary care, multi-agency waiver programs, EMS matters, and long-term care. So a lot to cover, but before we do that, as is the custom, Mr. Chairman, I'd like to take a moment to thank those colleagues of ours for their years of service. And as I mentioned last month, to include those who have hit their 1-year mark, which is quite a milestone in its own right. We're honored that you're part of the family. So for our 1-year colleagues, we have Kenneth Cobb, Kenneth Morrow, Traylor Rogers, Anita Dunbar, Quandra White, Derek Wasden, Olubunmi Fovi, Luann Jordan, Michael Smith, and on to our 5-year colleagues, Dior McWhorter, Ronald Acuff, Flossie LeCount, Stephen McCauley, Taisha Shaddy, Matthew Perry, Donna Elrod, And moving on to our 10-year colleagues, William Moore, Susanna Lipscomb, Trinette Brooks is at the 15-year mark. Sheila Todd is at the 20-year mark. Wiana Brimbridge at the 20-year mark. And for our 25-year club, Roosevelt Charles and Anita Vincent. So thank you for your continued service to our state. We really value the commitment you've made to this organization and everywhere else that you've served and the lives you've touched in the process. So with that, Mr. Chairman, I'll hand it back over for today's agenda. Thank you.
Thank you, Commissioner. Are there questions or comments for the commissioner, please? Hearing none, we'll move into the first agenda item that we will be asked to consider for initial adoption. And I will turn it over to Brian Dowd, Deputy Executive Director of Policy Compliance Operations and Medical Assistance Plans, to make the presentation.
Thank you, Mr. Chairman, Commissioner, and members of the board. I am presenting for initial adoption a proposed Medicaid state plan amendment in order to expand allowable Medicaid practitioners that can deliver services at federally qualified health centers, or FQHCs. Effective November 10th, 2023, DCH proposes to modify the state plan for Medicaid to allow for licensed professional counselors, licensed marriage and family therapists, and certified peer specialists to deliver services within FQHCs. The expansion of practitioners in FQHCs is expected to be cost neutral, as the department anticipates no increase in utilization, simply additional practitioner types to deliver existing services according to their practice acts. An opportunity for public comment on the proposed change will be held on November 16th, 2023 at 11:30 a.m. via Zoom audio. Written comments are allowed to be submitted on or before November 23rd, 2023. If there are any questions, I'd be happy to answer them at this time, and would respectfully request your initial adoption of this Medicaid state plan amendment to extend practitioners within federally qualified health centers.
Thank you, Brian. Are there any questions, comments from the board, please?
Question, Mr. Chairman, this is David
Yeah,
Cruz.
David Cruz, go ahead.
Brian, will we also have to have an amendment for other providers to have the same service access?
Yeah, if there are additional provider types, yes. The state plan doesn't speak to like provider groups, but it does speak to practitioner types that are allowable to deliver in FQHCs. So that if there was expansion outside of this, which was in the legislative language in the last budget bill, we would have to modify the state plan again. That's correct.
That answer your question, David?
Yes, thank you.
Of course.
Any other questions, comments? Hearing none, is there a motion for approval for initial adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Yeah, Roger Folsom has moved for initial adoption. Is there a second?
Dr. Lee seconds.
Dr. Lee seconds that. All in favor, say aye.
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 Opposed? Abstaining?
I'm abstaining. Dr.
I'm
Rucker,
sorry.
I'm abstaining as a federal employee. I'm abstaining.
Was that Cynthia Rucker?
Yes, yes, sir.
Oh, okay, I'm sorry. Yes. Yeah, let the minutes reflect that she has abstained. Okay, any other abstentions on this issue? Hearing none, it is approved for initial adoption, and we'll look forward to the public comment.
Thank you, sir.
Thank you. Next on the agenda, we'll call on Lynette Rhodes, Medical Assistance Plan Comprehensive Support Waiver Program. And Lynette has 2 items to present. Lynette, you may proceed.
Thank you. Good morning, Chairman, Commissioner, and members of the board. As always, thank you for the opportunity to present. DCH proposed to sustain targeted increased rates that were previously determined eligible and authorized under the Appendix K authority, which ends on November the 11th of this year. The proposed rate increases will be initially funded through the American Rescue Plan Act. Following exhaustion of the American Rescue Plan Act funds, the state match for this rate increase will be financed through the Department of Behavioral Health and Developmental Disabilities. The proposed change, again, will be effective through an amendment to the now and comp waivers effective November the 10th. The impacted services include support coordination, community living support services, community residential alternative, community access, and financial support services. DCH proposed to increase the now individual cost limit to $47,124. Additionally, the department proposed to modify the waivers to allow for the continuation of the Appendix K authority, which allowed legally responsible persons to serve as family caregivers for family members. Legally responsible persons can only provide these services when they constitute care over and above that which a legally responsible person would ordinarily provide. An opportunity for public comment was held on September the 21st at 11 a.m. Written comments were due on or before October the 16th. We received a total of 39 comments. 5 of those comments were oral comments that were presented during the public hearing. The remaining 34 comments were submitted in writing. Due to time constraints, we will not call out each of the names, but will instead share the summary of those comments with the board. Overall, commenters were in full support of the family caregiver for hire provisions, as they will improve continued access to care and help to eliminate barriers that currently exist due to the workforce challenges. The commenters noted the challenges of locating traditional providers who are both qualified and willing to provide care to members with special needs, behavioral health challenges, and various disabilities. The commenters also noted the challenges with employee retention in rural and urban areas of the state and cited numerous instances wherein selected providers subsequently resigned upon finding higher paying jobs. Thus, the family caregiver for hire opportunity serves as a lifeline by allowing those who are most familiar with their family members, such as parents and siblings, to provide needed services. Lastly, in those instances wherein a legally responsible parent was unable to sustain employment, this again allows that legally responsible individual the opportunity to earn an income. The department thanked the commenters for their written comments and support. Second, the commenters were in full support of the continued rate increases that were previously approved under the Appendix K authority. And in response, the department again thanks the commenters for their written comments and support. I will pause there for any questions from the board.
Any questions, comments from the board for Lynette, please?
I'm sorry, does this include training as well for these family for hires?
I'm sorry, does it include?
Extensive training.
So the family members will have to be trained, yes.
Okay, thank you.
That answer your question?
It does, thank you.
Okay. Thank you, Lynette.
Okay.
Any other questions, comments, please? Hearing none, this is being considered for final adoption. And is there a motion for final adoption?
Same motions.
I'm sorry, go ahead, please.
I said Shane Mobley motions.
Shane Monwood made the motion for final adoption approval. Is there a second?
Cynthia Rucker.
Cynthia Rucker has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Lynette, thank you very much, and you may proceed to your next item.
Thank you. The second item we're presenting for initial adoption, and this is for a rate increase for emergency medical services, ambulance treatment without transport. And by way of background, in 2018, the department began covering a new service for emergency medical services ground ambulance providers, basically referred to as treatment without transport. Treatment without transport services includes the assessment, treatment, and pharmaceutical intervention by EMS personnel. Treatment without transport services typically arise from a 911 call, and upon the arrival of the EMT, the individual may refuse to be transported, or in some instances asked to be provided treatment on site. So the purpose, again, is to allow these ambulance providers to recover the expenses related to the member's refusal of transportation, or for those instances where treatment is deemed appropriate and provided on site without the need to transport the member to a hospital facility. The current reimbursement rate for this service is $30. The proposed increased reimbursement rate, which will be effective January 1 of 2024, is $753.35. This rate increase takes into account the direct care and labor provided by emergency medical technicians and paramedics, which on average takes approximately 45 minutes on site. This includes travel time to the location of the member, administrative cost, which include facility cost, equipment, supplies, software, maintaining of the EMS fleet. It also includes and takes into account telehealth services that are arranged with a physician and on-call emergency department physician consultations during the on-site treatment. Finally, the treatment without transport rate increase will definitely help to reduce the use of emergency departments. It will reduce high wait times and overcrowding in the emergency departments, as well as reducing the cost associated with emergency department visits. The fiscal impact for state fiscal year 24 is a savings. This will result in a total savings of $748,000. The state portion represents $255,000 and federal $493,000. An opportunity for public comment will be held on November the 16th of this year at 1:00 p.m. via Zoom. Written comments are due on or before November the 23rd of this year. I will pause now for any questions or comments from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption to go out for public comment?
Dr. Nelvally motions.
Motion has been made for approval. Did you get that? Is there a second to that?
Russell Crutchfield, second.
Russell Crutchfield has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved to go out to public comment. Thank you very much, Lynette.
Thank you.
Next, I asked Melanie Simon, our general counsel, is going to present two items for initial adoption consideration that relate to personal care and assisted living communities and regulations. And Melanie, you may proceed. Thank you.
Good morning. I'm Mr. Chairman, Commissioner Carlson, and members of the board. The Division of Healthcare Facility Regulation presents rules for personal care homes today for initial adoption. Can you hear me?
Not real well. Would you speak
I-
of?
I can speak up for sure.
All right.
The Division of Healthcare Facility Regulation presents rules today for personal care homes for initial adoption. These rules are found in Chapter 111-862 of the Department's Rules and Regulations. These particular rule changes are being presented pursuant to a petition filed by the Georgia Senior Living Association. Under the Georgia Administrative Procedure Act, interested parties may submit a petition to the department to request consideration for a rule change. As you may know, GSLA is a trade association that serves the long-term care industry and has many personal care homes and assisted living communities in its membership. The particular rule change being requested relates to staffing levels in personal care homes. The staffing requirements were last updated and approved by this board on August 12th, 2021, after passage of the Disabled Adults and Elder Persons Protection Act of 2020, known as House Bill 987. The rules require a staffing ratio of 1 direct care staff member during the day for every 15 residents and 1 person for every 25 residents at night. For larger homes, this is calculated based on an average monthly minimum, and the evening ratio is 1 staff person for every 20 residents. Also, they must have at least 1 direct care staff on each occupied floor of the facility. For memory care centers, the staffing ratio is 1 staff member for every 12 residents during the day, during waking hours, and 1 to 15 at night, again, based on an average monthly minimum. And the center must have at least 2 direct care staff present at all times, with at least 1 on each occupied floor of the memory care center. In addition, regardless of the specific requirements, the existing rules also require that the facility provides sufficient staff to meet the residents' ongoing health, safety, and care needs. GSLA proposes to add a definition of on-site to the rules that would remove the requirement of 1 staff person on each floor and would instead permit the facility to have staff available on the premises and reachable through immediate telecommunication. According to GSLA, this would provide greater flexibility and would allow staff to leave the floor if resident needs have been met. It is important to note that these proposed changes do not alter any of the requirements included in House Bill 987. The requirement to have 1 staff person on each floor was not part of the legislation. The department added that requirement for clarification purposes as part of its rulemaking authority. The department acknowledges the issues and concerns raised by GSLA. Staffing in the long-term care field has been a significant challenge for the provider community for many years in Georgia. However, at the same time, the department recognizes that well-trained, sufficient staffing is directly linked to resident care and safety. The department further recognizes that the elderly population served in these facilities can be highly vulnerable, particularly for those residents with Alzheimer's and other dementias. For this reason, it is the position of the agency that this issue should be thoroughly vetted through the administrative rulemaking process to allow for public comments to be presented from all interested stakeholders. A public comment hearing on these proposed changes is scheduled for December 11th at 2 p.m. via Zoom, and written comments are due by 5 p.m. on December 13th, 2023. An additional public comment hearing is scheduled for 3 p.m. on December 11th for similar changes for assisted living communities that I will cover later in today's agenda. The department is not asking the board to approve these rules on the merits today for initial adoption. Rather, our request is that the board approve these rules for initial adoption to allow the public comment period to open so that you can receive feedback on this important topic. Once the public comment period has ended, we will summarize the public comments and return to the board with all of that information so that the issue can be thoughtfully considered. And I am certainly happy to take any questions you may have.
Are there questions, comments for Melanie, please? Hearing none, we'll vote on these separately, the personal care homes initial adoption first, and then your assisted living community, because they're basically the same issue. Am I correct with that?
You are correct.
Okay, just a reminder to the board, we are, any vote today, if in fact the board elects to approve initial adoption, as Melanie has pointed out, is to allow for public comment. We know there are different views on this subject, and this will allow those views to come forward and be considered by the department before we come back to if the department elects to come back to present for a final. So what we're voting on today is moving it to initial adoption. And with that, I would ask, is there a motion to move it to initial adoption?
Russell Crutchfield moves for initial adoption.
I'm sorry, who was that, please?
Russell Crutchfield moves for initial adoption.
Crutchfield has made the motion to move for initial adoption. Is there a second?
It's Robert Coles, second.
Robert Coles has seconded that. All in favor, say aye.
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 Aye. Aye.
Opposed? Abstaining?
Dr. Nelvely abstaining.
Melvin Lee has abstained from that vote. With that, it has passed for initial adoption. And now considering the, did you have any other comments you wanted to make for the next item as it relates to assisted living, or is it the same?
It is the same. I will say these rules are found in chapter 111-863. And as mentioned, the public comment hearing will be on December 11th at 3 p.m. via Zoom. And written comments are due before 5 p.m. on December 13th for these rule changes.
Thank you, Melanie. With that, are any other comments or questions? With that, is there a motion for approval for initial adoption?
Motion for approval, David Cruz.
David Cruz has made the motion for initial adoption approval. Is there a second?
Roger Folsom, second.
Roger Folsom has seconded that. All in favor, say aye.
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 Aye. Aye.
Opposed? Abstaining?
Dr. Nelvely abstaining.
Dr. Nobley has abstained from the vote. With that, it has been approved for initial adoption. Thank you very much, Melanie.
Thank you.
Thank you. That concludes the items on the agenda today that we were asked to consider for a vote. Is there any new business that anyone knows that should come before the board at this time? Hearing none, the meeting will stand adjourned, and wish everybody a great Thanksgiving holiday, and look forward to seeing you or talking to you in the December 14 next board meeting. Thank you very much.
Happy Thanksgiving.
Thank y'all.
Thank you.
Bye.
Thank you all. Bye-bye.